Here's to your health, brought to you by Coliseum Health System. More than 1/3 of adults in the United States are obese. We all know how excessive weight affects your life, how you look, how you feel, and the things you can or can't do. Carrying excess weight increases your risk of developing diabetes, heart disease, cancer, and other life-threatening medical conditions. Studies show significant weight loss may improve or even resolve these conditions, but weight loss is often easier said than done. It can be a never-ending cycle of dieting, exercise, losing weight, only to gain it back again. That is why Coliseum Northside Hospital has begun offering lap band surgery. This minimally invasive surgery has helped hundreds of thousands of people achieve substantial weight loss and discover a happier and healthier life. With more on this life-changing surgery, here's Dr. John Bagnato.
I started doing lap band surgery in 2002, mainly because you could see the medical need for treating obesity. And the big advantage of the lap band was that it was safe. And that was something we really didn't have in surgery, was the ability to treat obesity safely with surgery. And that's been a very dramatic change, and it has been proven. It's got a great safety record, and then when you look at the effectiveness, how good it is for helping patients lose weight, it's what I call a no-brainer. If somebody would have told me when I was in training that I would be doing surgery to treat diabetes, I would have said, not going to happen, not ever going to happen. And that's one of the exciting things about being involved in medicine, is you see this progress and this transformation of treatments and diseases, and so when you get caught up in it, you really, it's kind of like iPhones and iPads and computer technology. You just go, oh, it's really cool. And diabetes is something that is such a ravaging disease. It causes blindness, it causes kidney failure, it causes limb loss, and people are just debilitated by it. The medical treatment is really just a Band-Aid. And in fact, people who take medicines for diabetes, they know this. What it does is it causes your insulin levels to go up. That it creates the sugar in the system. It creates more fat because it takes the sugar and pushes it into the cell where it's converted to fat. As they gain weight, they need more insulin, so it becomes a vicious cycle. The lap band is a tool that lets patients get out from under that vicious cycle, and it is so rewarding to me to see patients come back in and they don't need their diabetes medicines anymore. The band is a device that's put around the top of the stomach. I've got actually a model here. So this band fits on top of the stomach. It is attached to a port which is placed under the skin. So every month or 2 months we add fluid to the band, and it actually has a balloon here, and that balloon inflates, and as it pushes pressure on this part of the stomach, it causes food to stay here in this upper part longer, and that sends signals to the brain that says, I'm full, I'm not hungry. The average weight loss is 60% of your excess weight. So if you're 100 pounds overweight, the average patient loses 60 pounds. Now, that number is great for an average. It is not a good number for the individual because, as I said, this is a tool. If your goal is to put diabetes in remission, most of those patients only have to lose 30% of their excess weight. So and most patients who have diabetes, type 2 diabetes, are in their 50s and 60s. So their goal is to eliminate some of their medicines, if not all of them, and that weight loss can be as little as 30% of their excess weight or less. Now, on the other hand, if you're a 20-year-old woman who wants to get in a bikini, well, you're motivated to lose perhaps, 80% of your excess weight. So my point is that it's a very individualized weight loss tool. The nice thing about the band is you can eat normal food. Now, some patients will say, I can't eat bread. Some patients will say, I can't eat lettuce. Some patients will say, chicken bothers me, but steak is okay. So there's a lot of variation, but you don't have to be on a special diet. You can sit down in a restaurant and eat normally. You just have to learn to eat slow, and you obviously eat less. But the bottom line is, patients know if they're overweight, they have some need to lose weight, that is a diabetes, or just want to. And it's a very large portion of patients who qualify. If you want your insurance to pay, you're probably going to have a BMI of 35 to 40 with sleep apnea, diabetes, hypertension, or some other diseases, or a BMI of 40 or above. But we do have a cash price available if your insurance doesn't cover it. If your car breaks down, you're going to find a way to get another car, because you got to have a car to live today. You got to work, to get around. You know, your health is at least as important as transportation. So there's probably nothing you can do more valuable for yourself than to get your diabetes, high blood pressure, and get your weight under control.
Thank you for watching Here's to Your Health, brought to you by Coliseum Health System.